Hi everybody, my name is Mitchell Farmer and this is part 2 of a laboratory 2 covering some neck anatomy. So I'm going to start us off with the external jugular, which empties into the right subclavian. So the external jugular courses along the superficial surface of the sternocleidomastoid along the lateral surface of the neck, and it has several tributaries including the retromandibular, the occipital, and sometimes the posterior auricular as well. So let's really quick look at the external jugular. If I rotate to the model's left-hand side, I want to cover a couple cutaneous branches of the cervical plexus, starting superior and going inferior. So we have the lesser occipital nerve, which innervates the cutaneous area of the occipital area of the head. If we go inferior, we come across the great auricular nerve, which is supplied by or made by the C2 and C3 spinal roots. It supplies the region of the parotid gland, which would be right here, occupying this space, as well as the angle of the mandible, which, if you can remember, this area right here is the angle of the mandible. And the posterior branch of that supplies the skin around the mastoid region. So the mastoid is this osseous protuberance right here. If we continue inferior from there, we come across the transverse cervical, which supplies the skin overlaying the anterior triangle of the head. So recall the anterior triangle is about this area. So that skin overlaying that area is supplied by the transverse cervical. And then we come across the supraclavicular nerves, which is made by spinal roots C3 and C4. And it supplies the skin of the anterior thoracic wall, as far down as the sternal angle. So if you recall, I'll put in the manubrium sterni. So the sternal angle is approximately in the midline of the manubrium. It's a palpable landmark, about at the level of the second rib. So it can supply skin as far down as that. And that is the supraclavicular nerve. And then finally there is the accessory portion of the spinal accessory nerve, which innervates the trapezius muscle, highlighted here, as well as the sternocleidomastoid, which is going to be important for when you're doing your cranial nerve exam. So that's enough of posterior neck anatomy. I'm going to bring up some infrahyoid anatomy now, right here. Beginning with some anatomy of the thyroid cartilage and surrounding structures. So starting with the thyroid cartilage, this is like described as the cartilaginous shield. It's the Adam's apple that's palpable in males. It's important for landmarking because what you're going to do is you're going to landmark the thyroid cartilage. Then you're going to go down from that until you feel the cricoid thyroid membrane. Inferior to that, you're going to feel the cricoid cartilage, or cricoid cartilage. And that's going to allow you to find the thyroid gland for your thyroid gland examination. So there's not too much nuanced detail of the thyroid gland here as there is in the dissector, but you can see its general H shape, the middle being the isthmus of the thyroid, and then its two arms on either side. In some people it's going to be significantly lower than in this model, kind of around the sternal notch of the manubrium sterni. But you have to know this anatomy for clinical examination. Now I want to talk a bit about the common carotid. I'm just going to hide this digastric muscle and this stylohyaloid muscle, and specifically about the common carotid I'm going to discuss the external carotid, because the internal carotid kind of just goes up into the skull, and we'll be seeing some more of it, or you will have already looked over it in neurology. So I'm going to go from proximal to distal, discussing branches of the external carotid. So first we have, medially we have the superior thyroid. The superior thyroid, unsurprisingly, supplies the superior pole of the thyroid gland, but it also supplies the sternocleidomastoid, the cricoid thyroid, the thyrohyoid muscles in the internal larynx. If we continue going distal from there, we come across the lingual artery, which supplies, unsurprisingly, the tongue, highlighted here. And then if we keep going up from there, we will come across the facial and occipital arteries. So the facial artery, we've already discussed it, goes around the angle of the manubrium sterni and courses, of the mandible, and courses over the mandibular body. to supply blood to the face, whereas the occipital artery goes to the occipital region of the head to supply blood there. If we continue going distally or superiorly, we'll come across the auricular artery, the posterior auricular artery, that is, supplying the auricular region. And then if we come across the superficial temporal artery, this is going to be discussed a lot later or a lot more in later dissections when we dissect the entire temporal region of the head. So I'm going to leave it at that. So that's kind of a real quick overview of the external carotid and some of its various branches. Now I'm going to pull up the root of the neck, and we can talk a bit about that. So the root of the neck, the first thing I'm going to discuss is some lymphatics. This is going to be hard for you to see in the cadaveric dissection, but I think it's important to go over. So on the right hand side, we have the subclavian trunk. The subclavian trunk, it will drain the entire right upper extremity, and then it will drain into the junction point between the internal jugular and the subclavian, along with the right lymphatic duct coming from the right side of the head. But it drains significantly less than the thoracic duct. So the thoracic duct, if you can recall, it drains the entire thorax. Sorry, I'll stop zooming around here. It drains the entire thorax. It travels inferiorly all the way to the abdomen, where it combines with the cisterna chyli, which drains all the abdomen, and eventually it drains the lower extremities as well. So a whole bunch of lymph coming up through the thoracic duct in order to drain into the junction between the internal jugular and the left subclavian, as when it joins up with the left subclavian trunk. So damage to the thoracic duct can be quite dramatic, and definitely don't want that to happen because it drains so much lymph. And you can kind of see it coursing down inferiorly all the way here to eventually join up with here, where the cisterna chyli would be. I'm going to come up superior a bit again and zoom in for us. Okay. So the next thing I wanted to discuss was the phrenic nerve. So the phrenic nerve, if you're having difficulty finding it, and it can be difficult to find, it's on the anterior surface of the scalene anterior muscles. And if I go back to the model's right, it can be found, the vagus nerve can be found medial to it, as well as medial to the internal jugular. But it might be hard to find the vagus in your dissections because the vagus nerve will be within the carotid sheath, that tough fascial layer, which is difficult to appreciate on the model, but would definitely be evident in the cadaveric dissection. Now, continuing my random jumping around here, I want to talk a little bit about an area known as the interscalene triangle, which is a triangle formed between the anterior and the middle or medius scalenes. So basically, if you look here and look here, these both attach to the first rib. And if I draw a border or a triangle with the base being at the first rib, then follow up the middle scalenes here, and then follow down the anterior scalenes, you can see this triangle. That's the interscalene triangle, and it houses, I guess the reason I'm pointing out is because it houses a bunch of important structures. As you can see, the entirety of the brachial plexus travels through there, which I went over in MSK, as well as the right subclavian artery goes between the base of the middle scalenes and anterior scalenes, whereas the right subclavian vein goes anterior to the anterior scalenes. So if you're having trouble discriminating those two, that could be a landmark you could look for. Now, speaking of the subclavian artery, I want to discuss a little bit about the subclavian artery before I wrapped up for today. So the right subclavian artery comes off the right brachiocephalic trunk, but that's not the same as on the left side. On the left side, the left subclavian comes straight off of, and if I rotate around this way, we're going to get a better view, comes straight off the aortic arch. So the aortic arch gives off the left subclavian and the left internal carotid, as well as the brachiocephalic on the right side, which then splits into the right common carotid and right subclavian. Now the right subclavian itself can be split into, I guess you could say, three parts. There is the part that is medial to the anterior scalene. So here's the anterior scalenes, and then the section that's medial to it is part 1. Now part 1 generally has 3 arteries that come off of it. The first one is the vertebral artery, and this ascends superiorly between the middle and anterior scalenes. You can see it in the background right here, and that's going to be supplying, going up the vertebra posteriorly. The next artery is the internal thoracic, or the mammary artery, and then there is the thyrocervical trunk. My apologies. So the thyrocervical trunk, if we look at the models left or your right, the thyrocervical trunk itself has a whole bunch of things coming off of it. It has the inferior thyroid, which supplies the inferior pole of the thyroid, and we had already seen the superior thyroid. It also has the transverse cervicals. Sometimes it has the transverse cervical, not always. And then it also has the suprascapular artery. Okay, so those are the 3 arteries that come off medial to the anterior scalenes. The second part is posterior to the anterior scalene, and that only gives off one artery, known as the costocervical artery, which very quickly gives off the deep cervical artery. And then finally, on the third part, which would be the part that's lateral to the anterior scalenes, it gives off the dorsal scapular artery. But unfortunately, the dorsal scapular artery, I don't have it in this model, and so you'll have to find that yourself in the cadaveric dissection. So those are the 3 parts of the subclavian. A real quick overgo of the root of the neck. As you can see, the anatomy is very complicated. I suggest that you have a look in a book, read it up in an atlas before going into the lab, or else the lab is just going to be total nonsense with fascia everywhere and stuff like that. So make sure you review. All right, that's enough for laboratory 2 part 2. I will see you for laboratory 3.